Took last week off. Actually spent most of the day picking berries. It was great. This time of year in Portland is awesome. So it's really, really good because lots of options for berry picking. So that's how we spent our Juneteenth. I don't know how everybody else spent it, but that's how we did it. Good morning. How are we, Mika? It's good to see you. Yeah, I was just saying I spent last week picking berries. That was the most of what I did on my Juneteenth. I love this time of year. We do a lot of berry picking, so it was a good, awesome. Thank you. I appreciate you. All right. So I wanted to talk about something called AGEs. So AGE, or Advanced Glycation End Products. They're kind of this interesting process that happens in cooking. And as a result of that, so these end products happen just normally on a cellular level. There's certain activities that will do that in our body as we sort of metabolize things. But then we can actually produce more of it in cooking, the food choices we make, how we cook those foods, and certain exposures that we have. And then AGEs are known to accelerate inflammation, oxidative stress, and those things tend to worsen health outcomes. And the reason I want to talk about it in the context of menopause is through this process that we've been, spending Thursdays together, we've been talking about all the things that happen through this menopausal process. Perimenopause, into menopause, and then post-menopause. As our estrogen levels decline, we are at an increased risk for heart disease. We know our vascular system changes. We know that puts us at increased risk for blood pressure, increased risk for cardiovascular disease. Actually, just recently published a new blog that talks about endothelial health, sort of that inner lining of our blood vessels, and how hormonal changes, i.e. estrogen and menopause, can sort of change that endothelial health, which then can lead to high blood pressure, increased risk of heart disease, which can then, again, increase risk of stroke. So take a look at that blog, because I think that should be helpful for people to understand how interrelated all of this is and how important it is to be working with someone like myself that's really watching the whole store and not just, hey, here's your hormone. Yeah, those docs are likely saying, hey, what's your risk, right? Do you have any risk of blood clots? Do you have risk of, have you had breast cancer? Do you have early heart disease in your family? Those sorts of things. And then prescribing hormones. But are they really digging into the underlying physiology and the root cause? And are we managing all of that, right? So that's what I get pumped about, and that's what I spend a lot of time talking about. Some of that doesn't resonate with people, right? Some people just want the hormones and they don't want to really change their lifestyle. They don't want to understand. But if you want to understand and you want to really have true control over your lifestyle, then I would highly encourage you to give me a call. So we've been talking about how as we go through this perimenopause and into menopause, there are lots of changes that start to happen. We are at increased risk for things. Heart disease is one of them. Our bone health starts to decline, or I should say our bone health is affected, right? We talked, I don't know if it was a couple weeks ago, about how we build bone through our younger years. And then really it's about how fast are we going to lose that density, right? There's this maximum period, kind of 2 to 3 years before menopause and a few years into menopause. That is the fastest period of decline in our density. So we know that's going to happen, right? So increased risk of heart disease. We know our density is going to change and our bone health is going to be compromised as a result of menopause. We know that our cognitive function is also at risk as we start to lose lose estrogen. I apologize. As we go into going through perimenopause and into menopause, as it changes our cognitive function. One of the common symptoms is brain fog, right? We start what? People talk about menopause brain, right? It's like you're not processing and your cognitive function is not quite as snippy snap as it was prior. So we know all of this stuff, right? We know, or hopefully you now know if you didn't know before, but spending some time on these Thursday, you're starting to understand that there are some things that we're in increased risk for. Knowing that, I always like to make sure people can understand, okay, that is a natural part, right? We get that. But are there things that we're doing that could be accelerating that process? It could be putting a little gasoline on the fire. So AGEs is one of those things. Again, they're Advanced Glycation End Products. They are produced when we cook protein or fats, and then when they're combined with sugars. When that happens, that end product accelerates inflammation, it accelerates oxidative stress, and it accelerates sort of cellular dysfunction. So what does all of that mean? Well, if you think about, again, the normal kind of inflammatory process that may be happening in our blood vessels, again, estrogen is declining. It changes the inside of the blood vessel, called that endothelial lining. And again, I just put out a blog on this, so I won't spend too much time on that, but my most recent blog really gets into vascular health and that endothelium and how that changes and how inflammation really affects that. So when we add AGEs to that, right, we're going to do this natural sort of aging process. That endothelium is going to change as our estrogen level declines. That further accelerates that change in our vessels. Then now we're choosing foods, whether they are inherently high in AGEs or Advanced Glycation End Products. Those food choices are processed foods, right? Anything that's bagged, canned, has been preserved and put on a shelf, sits in the middle of the grocery store, processed. Those are going to be higher in AGEs. Hot dogs, bacon, sausage, anything, again, that's processed, right? Those processed meats, really high in AGEs. Sugars, really highly refined foods, tend to be high in AGEs. If we are cooking food, grilling food, charring food, as opposed to, like boiling or steaming it, that's going to create an increased amount of AGEs. So we've got this propensity or this risk factor to have kind of this inflammatory process happening. Our endothelium is already at risk because our estrogen is declining. Now, if we are compounding that by eating foods that are high in AGEs, we are going to accelerate that process. So then that further increases our risk of high blood pressure as we get older, right? Super common, women, menopausal period, perimenopause into menopause, we start to see, our blood pressure is starting to tick up. You haven't done anything different, but again, eating foods or making food choices that are adding AGEs to your cellular function, adding inflammation, adding oxidative stress, and we have this decline in estrogen, just like compounds our risk. So blood pressure starts to tick up, further increases our risk of heart disease. We know as that endothelium changes, it can increase the risk of forming plaque and clots. That gets accelerated, right, if we're starting to introduce these AGEs and Advanced Glycation End Products. So it's AGE, right? It ages you. It increases your inflammation, oxidative stress, right? All of those things. So it really puts us at significantly more risk. And that has to do with your vascular system. That's that risk for heart disease. And again, when we think about cardiovascular health, it's not just the pump, right? It's all of the network of vessels that leave the pump and come back to the pump. So that's everything going all the way down to your toes, your eyes, into your kidneys, into all of your organs. All of that network gets affected. So it's not just what's happening inherently in the pump, it's all the blood vessels. So I've been thinking about, a patient that I see in a different context who has a lot of like peripheral vascular disease, lots of, in his legs. So he's been seeing a vascular surgeon, and this is someone that I acquired, again, in a different work environment, not in my private practice. And that same sort of decline in his vascular system that's happening in his legs, that's happening other places, right? So this process can happen for years before we start to get symptoms, that people more characteristically or will assume is like heart disease. He's not having chest pain. He's not having shortness of breath. He can still, do his daily activities, but he's got this huge vascular compromise happening way down in his legs. Well, think of what's happening closer to the pump. It's the same process, that same decline and that same inflammation in that endothelium that's worsening his vascular function is happening closer to the pump. So symptoms cannot be kind of the classic stuff, and they start to happen years before we develop kind of the things that we sort of think are, oh my God, I think this is my heart kind of thing. So that's just your cardiovascular system and how, again, menopause, it's going to happen. We, unfortunately, we can't opt out of that one. So it's going to happen. So how do we stack the deck in our favor? In our earlier years, your 20s, your 30s, start building your bone health. And man, if you've got young daughters, please start talking to them about this. Start having this conversation. Start helping them develop the lifestyle choices, the physical activity that builds health. Because we know as we go through perimenopause and menopause, there's just some natural changes and some natural increased risk that's going to happen. So we want to put chips in the bank early. So that's cardiovascular. That's the pump. That's the blood vessels. The endothelium starts to change as a result of loss of, decline in estrogen. And then again, if we're compounding that with ages, these advanced glycation end products in the inherent foods we choose or the way we're preparing the foods. So it's basically, if you're going to blacken something, you're going to char something, you're going to throw it on the grill and, get that crisp sort of skin on it, right? That everybody loves. All of that is super high in ages. It's just going to accelerate that vascular decline and I was going to say the unhealthiness, but I don't think that's a word. The endothelium, the inside portion of your lining of your blood vessel. So it's going to worsen your cardiovascular health. So now let's talk about bone. So we know, again, we build bone early. We've got this, period 3, 5, 6 years or so in and around menopause when we do this rapid decline in our bone health. It's coming. And then we talk about ages on top of that, right? These end products and the foods we pick or the way we eat them, that also can accelerate sort of the ability to kind of retain your bone, because you're not actually building new bone once you get past your 30s, right? At that point, you've got what you've got, and it's like, how do you maintain that? How do you maintain that density so that you don't have that rapid decline? Because there's some natural turnover, right? The bone is constantly remodeling. It's making, it's breaking, it's making, it's breaking. And that's why we want to do that weight-bearing exercise earlier in our years to have the best density we can, so that as we start to do some of this natural decline, we don't end up being osteopenic or end up with osteoporosis, which we went through a couple weeks ago. So if that doesn't sound familiar, that should be up on my Instagram. Take a listen to that talk about bone health. And then I'm also putting most of this stuff on YouTube. So if you're on there as well, it should be there as well. So kind of the highlights end up on YouTube, but the full video should be here on Instagram. So we know, again, perimenopause, menopause, rapid decline in our density. And then again, we compound that if we're choosing foods, whether in the way we cook it or the type of foods, increased amount of ages, again, accelerates that process, putting us at risk for faster decline in our density, increased risk of osteopenia and osteoporosis. And why do we care about this? So there's research that's been done that when we get into our, I don't remember the research, so I don't want to throw a number out that's going to be inaccurate, but, if we're in our 80s, 70s, 80s, and we take a fall and we break our hip, there is data that shows that our mortality, we have like a 5-year, 6-year, I'll have to find the research again, but there's this real deep correlation between kind of hip fracture in our later years and how quickly thereafter we decline, and not just in our our mobility, but then our risk for death. It's something like 5 years. So the goal, right? Prevention first. Man, prevention first. What can we do now to stack the deck in our favor? It's making sure our density is as good as it can get. Making sure, as you know, that when we are entering and going through what is coming, perimenopause and menopause, we're not accelerating anything by consuming foods or cooking our food in such a way that increase these advanced glycation end products called AGEs. Because we do not want to be in the bucket where in our 60s we're getting a DEXA scan and it shows we have osteopenia or osteoporosis, which is really what we want to avoid. And now we're trying our best to take care of you through the rest of your life, hoping that we don't have any untoward events where you end up with a hip fracture or compression fractures, and then your quality of life, and it just becomes this really, it's like quality of life, right? We didn't go through all of this madness, raise these beautiful human beings, moms and grandparents, to these wonderful people, to have the last 10, 15, 20 years of our life like not be around and not have the health and vitality to be with our family and our grandkids if we have them. So it's really about how do we stack the deck now so that 70 plus looks amazing, right? We're not like, oh my God, I've fractured my hip or I have right? So let's do the work now. Let's do the prevention now. So we know perimenopause and menopause increases our risk for heart disease, not just the pump, but the whole vascular system that leads to it. We know that period of time we're in an increased risk for osteopenia, osteoporosis, right? Our bone health declines. We know that our cognitive health declines. So knowing that, today I'm talking about these things called Advanced Glycation End Products, or AGEs, which can compound and worsen inflammation, oxidative stress, and just sort of cellular dysfunction that can rapidly increase all three of those: your cardiovascular health, your brain health, and your bone health. The same things that we know we are at increased risk for as we go through this sort of perimenopause and menopausal transition. Good morning, Rhoda. How are you? So we talked about how AGEs worsens the cardiovascular system. And again, there's a blog out there that I just wrote on that. So spend some time on that if you want. I touched on, bone health. It worsens kind of that decline in our density that's already kind of coming. And then let's talk about cognitive health. So cognitive health, there's this, a lot of, I'm having a hard time saying what I want to say because I'm trying to decide how I want to go with this. So my grandmother, she suffered from dementia later in her years. And, there's a certain amount of sort of cognitive decline that I think we can anticipate. But I also feel, and I also know that it's not just, that's normal aging. Right? We're all just destined to get some degree of dementia because that's just the normal aging process. I would say no. Yes, we're going to do some degree of, we're not going to be as like snippety snap as we were in our younger years. But I also honestly feel that we have a lot more that we can control with our cognitive health, and how rapidly that may happen, and how healthy our brain stays later in life. Again, we know that menopause is going to affect our brain health. We know that it's going to do that. We get this brain fog, right? We're not processing quite as clearly as we used to. It can change our mood, right? There's a lot that's happening from a neuro standpoint. And again, AGEs just rapidly increases that because from a cellular level, it generates a lot more inflammation. It generates a lot more oxidative stress. That inflammation is what breeds sort of this decline in the brain's ability to do all the rinsing and detoxifying that it's supposed to do when we sleep. We encode our memory when we sleep. So when we are unable to do that detoxification, when we're unable to sort of maintain the vascular health, right? The same blood vessels that lead everywhere else, it's the same thing, right? So if we have vascular disease elsewhere, then the vascular system in our brain is also showing some compromise. And if we're not able to do all of that detoxification, it worsens our cognitive decline. So again, choosing foods, and again, they are the highly processed things, right? The things that sit in a bag for months and months and months on the inner portion of the grocery store, things that have to be preserved for months and months and months. Those things have high degree of ages. Processed meats, your hot dogs, your pepperonis, your sausages, high amounts of ages. If you are choosing to grill or char your food on the grill, right? We toss the chicken and we toss the things on the grill and we get that nice crispy skin on it. High amount of ages worsens inflammation and worsens that oxidative stress, which again, that underlying inflammation is brutal to our health. It is brutal. And my understanding and appreciation for how detrimental chronic inflammation has changed. I was talking to somebody the other day, when I was in med school and going through residency, as we started to kind of go into our clinical years, and I would run into people and they would talk about, chronic inflammation, and I poo-pooed it, right? I was like, there's no such thing, right? Because I know about acute inflammation. I know the body creates this acute inflammatory response when something happens. You cut yourself. There's some sort of acute things that need to be dealt with. Boom, the body takes care of that. But the notion of chronic inflammation, I honestly thought was like woo-woo. And now here I am, many years later, after doing lots of reading, and I continue to read, I continue to learn, and I continue to sort of evolve my thinking, because science changes. We learn new things, and the science evolves, and we grow, and chronic inflammation is real, and it is a deterrent to our health. It worsens our cardiovascular health, our vascular health. It worsens our immune system. As we've talked about, it can worsen our bone health and our brain health. So chronic inflammation is real. It is one of the root causes to what we treat in medicine. The other one is insulin resistance. That also, high blood sugar, that insulin resistance that starts to happen can worsen inflammation. So they all kind of work together. And then we see these downstream effects to our health, but we've had years of it. But really, we're catching it, before you get symptoms. Things have been going on for years. So start now with the prevention. So cognitive health, it has to do with the vascular system. The brain needs, all the things. So it needs, blood supply. It needs to bring, neurotransmitters. So all of that vascular system is the same system that feeds your heart, that feeds everything. So we need to keep that as clean and as a low inflammatory burden and as little oxidative stress. Our food choices matter. Staying away from things that ratchet up your ages. AGE, you can look it up. Do a search on ages. All of that will worsen inflammation and oxidative stress, which in turn worsens your cognitive function. So be mindful of what we do in our earlier years and as we get through perimenopause and into menopause, because we know there's going to be this natural decline and an increased risk for heart disease. Our bone health sacrifices and our brain health starts to take a hit with sort of that decline in estrogen as we move through perimenopause and menopause. So doing things that are going to worsen that, one of them being ages, Advanced Glycation End Products, just worsens it, just speeds up and accelerates that decline and accelerates our risk. Because we see, right, as we get 40s, 50s, women, our blood pressure starts to tick up, our lipid profile, our cholesterol panel, we start to see an increase in triglycerides. Again, our brain function can start to decline. We're at an increased risk of osteoporosis. So we know some of that is coming, and rather than just waiting for it, right? And, as a doc, the things I think about when I see people, it's, okay, we know this is coming. How do we start now with lifestyle choices, education, resources, support, to put ourselves in the best situation so that when we start to enter this phase of our life and we have some of these increased risk, we're not compounding that. We're not going to accelerate that. So that's what I spend a lot of time talking to people about. And again, if I get a patient that's already, menopausal or perimenopausal, it's making sure we're assessing their risk and educating them and doing a good job knowing what their baseline is now. And that's not just labs, it's your lifestyle. So when patients join my practice, they do not, hey, do you have high blood pressure? Do you have, this? What medications are you on? And what's your family history? I do a lifestyle inventory, right? How are you eating? Do you sleep? How much are you sleeping? Do you move? How much do you move? What's your stress like? How do you relieve stress? What's your go-to? Who's your crew? Who are your people? Do you have a support network? I do a mental health assessment on all of my patients because there's no way that our mental health does not affect our physical health. And I am one that is a firm believer that we have to talk about mental health more. So my patients do this comprehensive intake so that I know the whole person, because I can tell a lot about your risk based on your lifestyle. So that's what I spend the bulk of what I do. And I already know coming in what you're at risk for based on your lifestyle. And then I get labs to say, okay, are we showing symptoms yet? Are we showing objective data to support where I think you may or may not be headed based on your lifestyle? And then from there, then we talk about, okay, what's going to be our plan? One, what are your goals? What are you trying to accomplish? And then how do we get you there and how do I support you to get there? And then obviously, anything else that comes up acutely, I take care of as well. So look up AGES, Advanced Glycation End Products. I actually did a blog a little bit ago. It's on my website. I would definitely take a look at the vascular health, the endothelial health, and the how inflammation affects that. That's a recent one on my website, so please take a look at that. If you have any questions at all, let me know. I'm here. I'm available. And if you don't have support, if you don't have a doc that is comprehensive, that is focused on prevention and longevity, I would love to have you in my practice. So definitely reach out. I'm happy to answer any questions and welcome you to the practice. Alrighty? Thank you for joining me today. I know it's kind of short and sweet today. Any questions before I sign off? I apologize. I didn't even throw that out there. Normally people know, just interrupt me. So I'm assuming nobody had anything, but any questions before I sign off? Thank you, everybody that showed up. I appreciate you. Anything at all? All right. Awesome. Take care. Thanks for joining. Have a great day. Bye-bye.